come up. And I think since we know that regionally we have arsenic in the ground here, we have communities near Lubbock that have had to shut down their water supplies because of arsenic levels in their water. And I think it would be important for the Board of Health to treat this as a potential health problem. And of course, we all recognize that the amount of drilling that's going to be done here in Lubbock is not a lot compared with what's going on around us. That's a bigger problem than this. Also, of course, our water supply comes from farther away, and that's where more drilling was done. So I think it's important for Lubbock to be aware of the problem and then to also join in with other cities around here in protecting our water supply, which is much more important than oil and gas, because without our water, there's not going to be any Lubbock.
Without oil and gas, there's not going to be any water.
Well, we have to have some, but we don't need, there's other ways, there's also wind power, there's also a lot of other things that you can use to pump water, as we've known from the past, and wind power was used for many, many years.
Until the Industrial Revolution.
But the point is, we're on the verge, we are in drought conditions here. We have a shrinking water supply. We heard from the board, we heard from the water department here in Lubbock that within 15 years, all the current supplies are going to be empty.
Of what?
All the water supplies coming into Lubbock are going to be down to where we can't get any more water in 15 years.
Lake Ellen Henry's levels have been going up ever since we started pumping
They
water.
showed that once we start pumping from a lot of Lake Ellen Henry, they showed their own projections on this, Don. It was not my numbers. This is our water department. It was their numbers presented in this room.
I know. And I checked
15
on there,
years.
and the level of Ellen Henry is going up.
I don't care. These were their numbers. You show me the data otherwise, good. But we're going by what the water department showed us here. We have a serious problem. And I think it was important for the Board of Health to tell the city that we need to face this as a problem that's a really important, dire circumstance.
Well, and I think dovetailing with that is just at the time, and I'm sure Dr. Epstein will keep us advised that at the time that the subcommittee submits a report to the City Council, I believe that it would be appropriate for us to reassert our resolution that we passed last May, just as a point counterpoint to this, which again, what strikes me is that when you look at the industry, these are best drilling practices that come out of industry. And so I think from just a point of influencing the council, just to present contrasting views, that the opportunity is there for all views to be expressed. And I just want to reassert what we had previously done back in May in our resolution. So I'm sure that since that may not happen until, or probably won't happen until after our next board meeting, I think we'll probably be okay to. So we may have sort of a re-resolution that we can just bring reaffirmation of the resolution previously discussed yesterday.
Well, I think it even needs to be stronger than what we said the last time.
Well, we can revisit that, I think, at the April meeting, but I do appreciate your keeping us involved. Any other questions for Dr. Epstein? No? Okay. Some good news on the PSA competition. I have secured $1,500 so far. Sadly, from people who've been touched by tragedy. One of them was a gentleman who I've known for many years, whose 19-year-old son got really into the synthetic marijuana to the point to where he didn't take care of his diabetes and it killed him. And so now this gentleman has pledged $1,000 himself, and then I've secured $500 from elsewhere. So the idea is a very straightforward one. I have secured a partnership. The YWCA is going to be the principal on this. Okay, Glenda Mathis has volunteer organization. They're going to be the ones that we run this organization through. So it won't be an official board of health, or even the city can be supportive of it. But I'm very pleased that we're getting this together, and we're targeting 25 and under video producers, and I'm hoping we can get school districts involved, health educators, and like I said, at this point I feel pretty confident that I can get a couple more thousand, so we can have like a first prize that's $1,000 for a PSA that's 10 to 12 minutes long, that can be however they want to present it, like a shaky video camera, whatever, but I want to keep it to under 25 years of age, and then $1,000 for the first prize, and then probably $750 and $500 for second and third. They're going to give us a 30-second commercial to go with it, so that we can get local media to do a PSA within their, commercial lengths that will then link to where people can go check out the longer PSA that we can then also make available to any city anywhere who would like to have copies of this to show that we're doing kind of dovetailing with what the Warriors are doing with their public campaign. Dr. May?
What about getting some collaboration with the medical school and they have a drug program over there? This would be a great opportunity for you to tie in there, get grants, and make this a center of study for this.
Well,
I think you've got a great opportunity.
This is a prototype, and that may be the next thing, is that we show that we did this on private money, and then later on, if we get more entities involved that can offer additional support, I think that's because that's the way we're going to deal with this issue. Is going to be through education and getting the public involved. Law enforcement's always going to be shackled by the problems inherent to that. But anyway, that's enough.
Very importantly, it gives you your 501c3
Right.
affiliation for all of those donations to be tax write-off for those who...
Right, and I really appreciate the YWCA dovetailing in on this and helping us. Okay, so that's where we are with that. I'll have more information as I continue to put it together, but we're getting there. All right, last thing. Standing in for Mary today, who's sick, is Becky.
Yeah. I'm it.
Mary's in the statistics.
Yeah, she's in.
Yeah,
She is
no,
a
she's
part.
not any of these statistics,
Oh, okay.
thank goodness. We are continuing to see pertussis cases. Thank goodness they are down. We only had 5 over the last month. 4 of them were confirmed and 1 was a probable, which means that person met the symptoms but were not tested. So we have to call them a probable. We had 2 adults and 3 kids as far as pertussis goes. And I wanted to let you all know last month I didn't have any numbers for the number of TB cases from the state, but I got those this time. So for the previous month, they had 2 cases. This month, 0. And we had 9 invasive streptococcus disease, no deaths.
Okay. Any questions? Then lastly, some of y'all may have seen this. I don't know if you got it in your packet or not, but Ollie Thomas is moving on to bigger and better horizons. He has submitted his resignation because he's moving to the Miami and Fort Lauderdale area for his company. And he expressed his appreciation to the board and wishes us all the best. And so we're sad to be losing him. And of course, that means that we'll have an open position that will come up. So if you know a worthy candidate, if we can only get David Klein to move into the city limits.
He lives outside.
Yeah, he lives over in Floydada somewhere. But if you do have somebody that you think would be worthy, please advise them and ask them to, what's the board?
City Secretary's
Secretary's office. Just call them and find out more.
So they have to live within the city?
I believe that's correct.
Yeah.
Yeah, they have to be a little.
All right, any other business? Seeing none, then let's hope the weather stays nice and nobody gets
No,
sick.
it's going to be cold tomorrow.
No, I don't. Not, as long as it's not too cold. All right.
A minute.
Oh, minutes. We need approval of minutes. Do I have a motion? Move. Seconded, Dr. Cole. Okay. All right. No other business then? We finished right on the money. Thank you very much. See you next month. Sure. Sure. Just if you, Becky can give you her email address.
Yes,
and then
I know.
when
I don't
you
have
shoot
a
things
card.
to her,
I'm
appreciate it.
bad. Can I write it on your? Oh yeah, I'll email you, Kelsey. Okay, thank you. Yeah, thank you.
Just 11 yourself, Air Force. Outstanding. Thank you.
All right.
Okay.
Yeah, practice.
Sort of like that.
Yes, quick, snap them up before.
Sure.
May I keep this?
I'll tell you when I get home tonight, I can email it to you. I gotta, give me your, I think I have your address. Well, better give it to me again.
Somebody said stand down.
You'll write on the back of that.
Dr. Carmen.
Okay.
What was your So you were enlisted. Have you thought
Yeah, because I wrote up a little blurb on it, and that's how I've been getting contributions.
Yeah, I think too. We're gonna, and if you're just sitting tight, or I can go ahead and write on my.